So 1 in 7 women in New South Wales will develop breast cancer in their lifetime. Only 50% or just over 50% of women actually come and have a breast screen. And from the women that we surveyed, 69% of women said that they fear and have anxiety about coming for a mammogram, and it's mostly to do with pain. Using a curved paddle rather than a flat panel, women are more likely to return. The smart curve doesn't reduce the quality of the image, and that's also vital because we need to know that we can still see the right thing. With these paddles, we can see about 17,000 women a year. Women only need to come every 2 years. That's $34,000.
We are very excited to talk to you about our project, which is called Breathe Easy, Rest Easy. This ensures that no radiation oncology patient who could benefit misses out on referrals to evidence-based services such as Canteen or Quitline. There were only 8 referrals from Royal North Shore in 2018 to Canteen.
And Quitline, which is New South Wales's smoking cessation hotline, is also under referred to service. So we wanted to come up with a sustainable solution.
By adding 2 extra questions in the intake survey that every patient fills in prior to seeing us. So one about smoking and another one about the age of their children and whether they have children. And through that, we can identify which patient could potentially benefit from a referral and, if appropriate, refers them to these services.
So this is our problem. Collars are not being fitted consistently or competently by our patients, their carers, and even some healthcare workers.
Royal North Shore is a Level 1 tertiary trauma centre with many statewide clinical responsibilities, and this means we manage some of the most highly complex spinal injured patients.
Understandably, we don't discharge patients before they're ready to go home. But if they need multiple education and practice sessions, this ultimately increases length of stay and cost to the health system.
So we want to create an easily accessible collar education video for patients, carers and our staff.
And this is what our video will achieve. It will reinforce good collar care practice. It will supplement our in-hospital face-to-face training, as it will be the 4th type of education that our patients receive on top of verbal instructions, physical demonstration and a paper handout.
So now is the time for action.
We're one of 2 spinal cord injury units that take care of acute spinal cord injury patients in the New South Wales statewide spinal cord injury service. The patient experience is filled with psychosocial challenges, and the staff are not immune to that as well. So without something in place that we can process and reflect on our own reactions, we're very prone to compassion fatigue, vicarious trauma, burnout, all these sorts of things. Our idea is to introduce Schwartz rounds, which will provide a forum to discuss the emotional and psychosocial aspects inherent in caring for patients, and we propose to hold those monthly with trained facilitators. So the outcomes, we hope to improve insights into the emotional and social aspects of clinical care. We'd also aim to look at staff's perception of support for them as providers and also teamwork. So we're asking for $17,000. The majority of that would go towards training. Our take-home message is that we'd really like to support patient welfare and patient care by supporting staff welfare. Thank you.
Thank you.
As we all know, health is a constantly evolving, dynamic field. We're all committed to a lifelong process of learning. As I think we've become busier clinically, it's getting harder and harder to have protected teaching time.
What should we do about it?
Something that allows us to capture these teaching sessions, these tutorials, these meetings, so that people can watch them even if they can't physically be there at the time.
So just recording the lectures?
Yeah. One of the greatest things that's come out of online learning is that people can learn in the intimacy of their own room, at the time and the pace of their own convenience, and the outcomes show learning's a lot better that way.
I mean, we could try and put something together that maybe works on sort of a library situation where the videos get uploaded to a central site and people can search for them. I mean, what if we were to try and put together some kind of a pitch where we could get funding to organize a central service? We can get some professional recording done. We could host it, maybe try and launch it sometime around February 1st. And then do things like track the analytics from how many views we get. And then we could use that to possibly put together a pitch to get permanent funding from like the university or something. What do you think?
Sounds good. Where would we get that funding?
I don't know. We're just going to have to think about that.
It's a fantastic idea to promote innovation across the hospital.
I think it's insightful, I think it's rewarding, and people get to showcase exactly what they want and how they can achieve it.
I think it's a really good idea. They all seem like ideas that are worth pursuing and getting funding for, so I think it's a really good platform.
You know, it is it's the unassuming nature of so many people in this local health district that you come forward with these things sort of not matter-of-factly at all because you're very proud of what you do, but it's quite overwhelming the calibre of the people and the ideas you bring and the care and detail and attention. So yeah, we were just all struck by each and every one of you, so thank you. We've decided to give the winning pitch to Brace Yourself, Annalise and to Judith.
I was actually really surprised because obviously ours is only a small amount of money that we were asking for, so I thought that there would have been a few winners, but being the only winner, we feel like very, very, very lucky.
I think it's been a great experience for us to be able to present our ideas as well, and we've talked to a few different avenues in the hospital, so corporate communications for example, and just looked at ways that we can make a proper video, and the one thing that people kept on coming back was innovation is one way to get that funding and to get that support.
It's great to be part of this program and see all the other great ideas. Yeah, it's just great to be a part of it in general, definitely.